To use the neonatal screening web portal, first go to the State Hygienic Laboratory website at www.shl.uiowa.edu. Click on the green Test Results button on the left-hand side of the page. Next, you'll click on the blue Neonatal Screening button. Enter your SHL username and password, and then click on the Sign In button. You'll see a gold bar at the top with a link to change your password and another link to log out. And on the left-hand side of the page, you'll see green headings. The first tab that you'll see is called Patient Lookup. You can use this to look up an individual patient's final report. You can enter the name of the baby in the patient field. The format for the name of the baby is always last name, comma, space, first name. You can narrow your search down by gender. There are calendars to the right of the birth date fields to help you put the date in the proper format. There is an ID number field. This represents the patient's ID number in SHL's internal system. So if you are told that number, you can also search by it. The chart number field represents the hospital's chart number or medical record number or whatever patient ID they assign to the baby. So this is also a field that you can search by. And finally, there's the lab number field. This is SHL's lab number. And so if you know that, that's another field you can search by. If I was to search by a birth date range, I would first enter the birth from and birth to dates, and then click the Run button. Notice that I received back 4 patients. It shows their last name and first name, birth date, their facility ID, gender, the SHL lab number, and the collection date. All I have to do is click on the name of the baby, and the final report will pop up in a PDF format. I can then save the final report and attach it to the patient's record in my hospital system, or I can print it or do whatever else I need to do with the report. The next tab is Download Reports. This tab is used to download a batch of reports, and it goes by release date, so whenever the sample is released. Many hospitals will have a staff member going in the morning and search by release date from yesterday's date to today. Next, click the Run button, and all of the final reports that have been released in that 24-hour period will be downloaded into one PDF document, which can then be printed or saved into the hospital system. The next tab is called Samples Received. If you cannot find a final report through either the patient lookup screen or download reports, you should go to the Samples Received tab to see if the sample testing has been completed or not. Here you can search by collection date. Enter the beginning collected date and the ending collected date, and then click on the Run button. If you want to change your dates, you can always click the Reset button and re-enter them. After I click the Run button, I will get a report that will pop up. At the top, it'll show the date range for the samples received, the name of my facility and the city and state, and then a listing of the samples. The listing shows the date that the State Hygienic Lab received the sample, the date it was collected, and the status, either complete or incomplete. If the status is complete, then I should be able to find a report of the results through either the patient lookup or download reports links. If the status is incomplete, then the testing isn't finished yet. This report also shows the chart number of the baby and the last and first name. The next tab, called Quality Control, is used to bring up the Quality Assurance Report. I enter my beginning collected date and ending collected date for which I want to run this report. And then I click the Run button. A PDF of the report will pop up showing the date and time that I ran the report, how many pages are in the report. Here's the name of the report, Quality Assurance Summary Report, and the date range that I ran the report from. The name of my facility and its city and state are found on this line. And here's the listing of samples that had quality assurance issues. In the first column is shown the last and first name of each patient where there was a quality assurance issue on their sample, the patient's chart number, and then these next four columns show the issue. In this column called Rejected, it gives the reason why the sample was rejected, such as quantity not sufficient, the blood had layered or clotted, or it didn't soak through the card. This next column shows if there was an early collection. An X will be found in that column if that's the case. These last two columns will show if there was an unknown weight or unknown transfusion. At the bottom are found the subtotals for each of these four categories. And over in the bottom left corner, you'll see how many samples are on the report. In this case, there's 9 samples. The last link is used to run the turnaround statistics report. This report also goes by collection date, so I enter my beginning collected and ending collected dates. I can also change the sort order by clicking on this drop-down list. The samples on the report can be sorted by the date received, the birth to collection, turnaround time, collection to received, turnaround time, received to reported, turnaround time, birth to received, turnaround time, or the total time from birth to reported of the results, turnaround time. I then click the Run button. The PDF of the sample turnaround report pops up. Once again, the date range is shown at the top along with my facility name and address. The patient's last name and first name is shown in the first column, followed by the patient's chart number. The third column shows whether this sample is a repeat specimen or not. If it's a repeat, it will have an X in this column, and it will not be included in the average calculations at the end of the report. These next columns show the partial turnaround times and the total turnaround time. The first 4 turnaround times are partial turnaround times. The last one, the birth of the baby to the report of the results, is the total turnaround time. The partial ones are given in hours, and the total time is given in days and hours. At the bottom of the report, it will show you the number of samples on the report, and then the averages. In parentheses after each average turnaround time is the number of samples that were used to calculate the averages. In this case, There are 218 samples on the report, but only 201 were used to calculate the averages. There's a note at the bottom that explains how the averages are calculated. Repeat specimens, specimens with date missing, and specimens collected greater than 5 days after birth are not used for determining the averages. It is important to always log out of the neonatal screening web portal when you are done using it, since it does contain protected health information.